Okay, let's turn from Mumbai to Delhi because the dengue crisis is now getting worse in the national capital. A 10-year-old girl has succumbed today to the vector-borne disease, allegedly due to medical negligence. It's taken the death toll to 17. Hospitals are now under severe strain, grappling with a rising number of patients. In Gurgaon, an international kabaddi player, Pratap Pahelwal, has fallen prey to the disease. Pahelwal died after battling the fever for several days. The Delhi government now is planning to provide extra beds to try and find a way to treat dengue. The big question, of course, that we are having is on the ground what's happening. Our focus here has been on the ground. Yesterday I had got you ground reports from Delhi's dengue epicenters. I'm afraid similar scenes are playing out across the city. Today my colleague Anjana Om Kashyap of Aaj Tak ventured into Delhi's Rangpuri area, where the nearest government hospital is 12 kilometers away. Private hospitals are beyond the reach of. This has led to quacks making a killing. This is Anjana's report.
हजारों लोग रहते हैं रंगपुरी के इस पूरे इलाके में, लेकिन सरकारी अस्पताल सफदरजंग लगभग 12-13 किलोमीटर दूर। लेकिन एक डॉक्टर जिसके बारे में तमाम लोग मुझे बता रहे थे कि जिस डॉक्टर को दिखाते हैं उसके पास हम पहुंचे हैं। तो ये ड्रिप इनको यहाँ पर चढ़ाया जा रहा है। डॉक्टर साहब हैं तो नहीं, लेकिन डॉक्टर साहब के नाम पर, जिनका यहाँ पर नाम है पूजा क्लिनिक, डॉक्टर एस बिस्वास, ये MBBS भी नहीं है। आप देख सकते हैं DAAMS कैट रजिस्ट्रेशन नंबर, लेकिन ये MBBS डॉक्टर भी नहीं है। तो जाहिर तौर पर किस तरह की सुविधाएं दे रहे हैं, किस तरह से ड्रिप चढ़ा रहे हैं, किस तरह के हालात में इलाज कर रहे हैं, किस तरह डस्टबिन पेशेंट के बिल्कुल बगल में पड़ा हुआ है। स्वास्थ्य सेवाओं के नाम पर यही यहाँ पर मुहैया है। तो डॉक्टर बिस्वास अब आ गए हैं। जरा डॉक्टर बिस्वास से पूछ रहे। डॉक्टर बिस्वास, आप MBBS डॉक्टर नहीं हैं, आप डेंगू का इलाज कर रहे हैं, आपको नहीं लगता है किसी की जान खतरे में पड़ सकती है?
नहीं, ऐसे तो ड्रिप चढ़ाने के लिए बोला था मेरे को, ठीक है, ऐसे ड्रिप ही चढ़ा रहा हूँ मैं। इलाज तो नॉर्मली कोई दवाई वगैरह तो दे नहीं रहा हूँ।
लेकिन ये तो आप लोगों को मिसलीड कर रहे हैं ना। आप सबको पता है कि डॉक्टर हैं, आपको तो लेकिन पता है कि आप MBBS डॉक्टर नहीं है। तो आप तो विश्वास जी है ना, डॉक्टर विश्वास नहीं है, तो ये आपको लोगों को भ्रम में तो नहीं रखना चाहिए।
नहीं, मैं तो सबको बता रहा हूँ। ये तो ज़्यादा सीरियस हो तो भाई और कहीं जाना है पूछो इससे, मैं बता रखा था। अगर ज़्यादा सीरियस हो तो भाई और लेना है, हम तो खाली ड्रिप चढ़ा देंगे। अगर बढ़ गया प्लेटलेट तो अच्छा है। कोई दवाई गोली तो नहीं दे रहा हूँ, पैरासीटामोल की गोली दे रहा हूँ।
कितने पेशेंट लगभग आए होंगे आपके पास?
डेंगू के हमारे पास आ गया 4-5 पेशेंट तो आ गया।
क्या डेंगू जैसी बीमारियों के सामने इस देश की व्यवस्था, सरकारें लाचार है, समर्पण कर चुकी हैं?
Okay, let me go straight across to Anjana Om Kashyap, who brought that report. Anjana, you got quacks now taking the place, it appears, of doctors. Did you find this widespread, or was this only in a particular area?
Actually, it's a very grim picture, Rajdeep. What I make out of it is, if we go to these slum areas, these resettlement colonies, then you see the real picture. It's a huge problem in the sense that in the entire locality, around 10,000 people live there. They're all dependent on one quack in their area. So if we go to these other resettlement colonies around that area, that's going to be the picture. The quack, as I showed you, was sitting there, and some of the people in the colony were even supporting him because that's the only one they rely on, they depend on. So that's the level of, you can say, the way the system is working right now. A quack is taking care of 10,000 people. Even otherwise, dengue, no dengue, he's the only one they go to for their health services. In spite of all this big controversy about dengue services and all the fogging not being done, no efforts have been made to hold camp by at least government doctors who could have gone there and done something.
Is there a shortage of doctors? Is it just simply that the scale of the problem is such there's a shortage of doctors?
There's a huge shortage of doctors, and doctors who would probably not go and want to practice in such a resettlement colony. B, it's become a huge business. The big hue and cries about Fortis being closed 2 kilometers away, but who can afford a Fortis hospital from this resettlement colony? So that's the picture that really portrays a very sad image of the entire way the system is working. Mr. Kejriwal or MCD, MCD and NDMC have really failed on the front of fogging or taking preventive measures, educating people. In fact, I talked to a man in this colony. I went around asking people, what do you make? What is dengue? There's a man who kept telling me there's a huge ball in the stomach that happens, and the way you bend your body, the ball rolls. So that's the kind of awareness people have in these colonies. So awareness, fogging, MCD failed miserably, and on the doctors front, the health services, you can see, Rajdeep, the real picture.
Anjana Om Kashyap bringing us that ground report. Well, the Prime Minister is doing a Mann Ki Baat on 20th. Maybe he should spread dengue awareness. Who better than the Prime Minister Why don't you, Mr. Narendra Modi, make your next Mann Ki Baat about dengue awareness? Just a thought being parked with you. Thanks very much, Anjana, for that report.